healthcare, education, research, and care. A city where 4 of the top 6 employers are healthcare providers. Where the largest medical center in the world is located, providing over 4.8 million patient visits each year. With more than 85 hospitals, including 13 teaching hospitals, and over 100 colleges, including 2 medical schools, 4 colleges of nursing, a dental school, college of pharmacy, and college of optometry. Houston is a place that employs over 100,000 healthcare providers. We need a healthcare center of excellence dedicated to interprofessional healthcare education, simulation, innovation, and a place that provides lifelong learning opportunities for working healthcare professionals and the community. The new model for healthcare is changing, from focus on treatment of disease to a focus on health and prevention. An interprofessional model where different healthcare providers work together on collaborative teams to provide a holistic approach to patient care, rather than individual providers tackling separate problems in a disconnected manner. A model that is consumer-driven, incorporating the evolving trends emerging from technologies such as facial recognition, artificial intelligence, predictive analytics, wearables, augmented and virtual reality. We need a space that captures a larger view and vision of who the community college student is. One that includes credit, non-credit, and supplemental support training for working professionals, and healthcare education classes for the community at large. We need to create an environment that addresses the learning styles and needs of the evolving student population and bridges the challenging skill gaps desperately sought after by employers. With growing needs and limited clinical capacity for instruction, we need to create simulation spaces that allow for instruction and simulation to take place in a way that reduces the burden on our community partners and allows Lone Star College to have greater ability to sustain the growing demands for program capacity. With programs that include dental hygiene, diagnostics medical sonography, paramedic and EMT, radiology technology, health and information technology, medical records coding, physical therapy assisting, respiratory care, medical laboratory technology, surgical first assistant, nuclear medical technology, behavioral health, substance abuse counseling and human services, long-term care, healthcare administration, polysomnography, eye care technology, dietetics, anesthesia technology, and other primary disciplines of the health sciences program. Redefining the role of community colleges in healthcare education at LSC-Tomball Health Sciences. Lone Star College is the 3rd largest community college in the United States with over 99,000 students. LSC's strong leadership, impeccable reputation, state-of-the-art facilities, respected programs, and strategic partnerships, which include over 400 affiliation agreements for our healthcare programs, make Lone Star College the obvious choice to lead Houston in allied health education at the entry level and as a support for the lifelong professional learning needs of all levels of providers in our community. We have strategically laid out a 6-year plan for the creation of the Health Science Center for Simulation and Innovation, which will open in 2022. 5 new programs will be proposed each year per Workforce Council guidelines. Existing space in the Creekside Center will be used to temporarily house new programs until the Health Science Center for Simulation and Innovation is completed. Resources from the Tomball Regional Health Facility in Perkins will fund the equipment needs for the programs. Existing open faculty positions from recent retirements will be used to fund the initial positions needed for hiring directors and beginning the program development and initial accreditation. Performance funding for growth in workforce contact hours and credentials will be repurposed to provide permanent positions for the new programs and allow the open positions to be recirculated each year for program development purposes as new programs are added. Tomball Regional Health Facility is also expected to be a resource for funding positions during the first year of program development until revenue is generated. Lone Star College-Tomball Health Science Center for Simulation and Innovation will be a 300,000 square foot building adjacent to the current health science building in Tomball. It will add and enhance existing healthcare programs that cover all aspects of healthcare, including emergency response, inpatient, critical care, long-term care, home health, dental, optical, rehab, behavioral health, and administration. The design will maximize the use of space and equipment by creating shared flexible space for simulations and laboratories for credit, non-credit, and community programs. We expect to generate over 600 degrees and certificates and over 1 million contact hours per year. Additional revenue generated from CE programs and workforce training through corporate college are anticipated, as well as programs that connect the community to our campus, such as K-12 summer camps and health and wellness programs for specific target groups in the community. The current design of health science instruction is territorial and creates silos that prevent interprofessional educational activities. We need more efficient use of space and costly simulation equipment and flexibility in responding to the rapidly changing workforce and community needs. We need to increase the use of simulation as a substitute for clinical time with limitations placed from hospital capacity. A design that focuses on shared space, collaboration, and innovation and broadens the view of potential students in programming is the only way to redefine the role of the community college in healthcare education. It is not only an opportunity for Lone Star College to continue our role in leading the future of higher education, but it is also our responsibility to meet the ever-evolving educational needs of our community. It is the time to redefine healthcare education.